morning, good afternoon, and good evening. And as I mentioned, I'm coming to you from Zagreb, Croatia. Just this year, we had our first in-person board meeting. I don't think we've had one for a number of years. So also on the line and in Zagreb with me is Cynthia Stewart and Greg Shaw. It's a really exciting Global Cafe today because we're really going to be listening to Kenneth Mugayehwenkyi, who is in Mbala in Uganda, and he's a transformative leader in the NGO sector. And Kenneth and I are going to talk about how he and his work is overturning preconceptions that are ageist in Eastern Africa. So thank you so much for joining us, Kenneth. Kenneth, I just want to start off by saying that when I was reading your bio and learning a little bit more about you, what really struck me is there was a certain incident early on in your life that really made you make a decision that really helped you return to Uganda. And that was meeting Margaret and Elizabeth. So perhaps you could start off by talking with us about meeting Margaret and Elizabeth and how that made a decision that changed your life, but also the lives of your family, your 4 children and your wife.
Thank you so much, Jane. Good afternoon, everyone, and I guess good morning in some places. I'm so honored to be hosted at the cafe and share with you all who I'm sure you are passionate about aging and older persons issues. I was very, very lucky to study in Canada for a short time and work in the United States. And because I was earning a little bit higher income, I supported orphan children in my country. And quickly I discovered that these children were living with a grandmother. This grandmother, Elizabeth, had named one of her grandchildren after her, and another one, Margaret. What first struck me was that Margaret and Elizabeth and their grandmother had no house. They lived in a shack. And I just wanted to help them have a house. So I helped them build a house. And the process of building a house had me back home. I participated in the actual building of the house, a brick house. And while I was there, I just thought so much about Elizabeth. She had lost all her family. She had 2 grandchildren. She was raising very little grandchildren away. And that's all she had left that she could hold on. So I tried to explain to her that I was actually a man of faith and I had some financial means to help her. And she bashed all of that because she knew many others in the same condition or better placed than me who had not helped her. And that really made me think of if somebody cannot even appreciate, how painful can it be that you can't even appreciate somebody building your house? So that prompted me to think about older people and their needs. And in a world where children were the ones everybody was running to help, including me, I discovered that older people in Uganda had no help because they had no pension. They had lost their only help, who was their children, to AIDS and to wars and to poverty. And they were left now looking after orphans, helpless. So I made a tough decision to return from USA and abandon the American dream, as people call it, not knowing how to be, but just to do what I could do in my means. And basically, I visited Elizabeth almost every day. She told me about her friends in the village. They became 8 that I visited, who told me the similar stories. And I asked them if we could meet regularly just to talk about their challenges, because they were the same and I had no solution. And what began as Elizabeth became 8 seniors meeting every week to talk to each other, and later became more and more. And as I speak now, it's over 1,000 in 2 countries of Ethiopia and Uganda. And cumulatively, over 2,000 have been meeting every week just to talk. Of course, later I learned that they were meeting to talk, but they would become hungry, so I had to feed them whenever they met. And then later, one of them missed what we call a fellowship, the weekly fellowship. And Clementine, she died actually early this year. I went to check on her and she had malaria. So I spent $1.50 to treat her malaria. And then I discovered they were falling sick as well. So at that point, I decided to mobilize my friends and reach when they fall sick. And these three areas of meeting together and food and healthcare have become the centerpiece of my work for the last 19 years. That's basically what I could say, what happened.
Well, look, Kenneth, many years ago, Yitzhak Brick said to me, you know, what makes you so happy, Jane? And I said, I have everything that I want. I have a roof over my head. I have enough food on the table, and that I'm loved. And that really encapsulates some of what you have created. But tell us a little bit about, you know, the ministry, you know, because you are now founder and executive director of the Reach One, Touch One Ministries. So talk with us a little bit about Rotom.
So as I said, when I discovered that the needs were more than just my personal visit, and I asked friends to give them some money, and I asked, including some American friends that I had made through my time there, then I needed to have a structure in which these monies were, it was no longer personal money, it was public money. And I had, by law, I had to set up a structure in which it is managed. So the Ugandan friends whom I knew that had experience with nonprofit management helped me from the first board. We got legal registration. My American friends from the support group, my Canadian friends from school from the support group, and we became nonprofit in the 3 countries. And since then, we have grown to become, I would confidently say, the most effective nonprofit organization in East Africa in service delivery. We do advocacy as well, but we predominantly do that. So we have now grown in our governance. We have actually in Uganda 60 staff, in Ethiopia 7 staff, in Canada a staff and 3 volunteers, in USA 4 staff, and in Germany and the UK. In the Germany, UK, Canada, and Ethiopia, we predominantly create awareness and raise funds. In Uganda and East Africa, we implement programs. So that's what we have become, a nonprofit, and we are a member network international. We are, which fights for the rights of all the persons, of the open-ended working group of the United Nations system. And I was very lucky, as Jane would know, last October to be very, very lucky and privileged to be recognized among the healthy aging leaders by the United Nations. So we are now profit.
Well, look, Kenneth, you know, as you know, I'm also one of those healthy aging 50. But when I hear your story, you know, I am at your feet with humility. So thank you. Look, I just want to talk with you a little bit about, you know, the sub-Saharan African region, Eastern Africa. It's a relatively young population. So how, in your advocacy role, do you build the case for government to invest in this population? And you were talking with us about what you were doing in Mbala right across the week. So can you share some of those insights? Because I think it's very important that we understand how the system is working and how Rotom is building the case for change.
So as you would expect, policies are made by politicians. Politicians want votes. They want votes from the majority, and the majority of Ugandans, East Africans are children and youth. These are predominantly focusing on child and maternal health, education, and the older people who are only about 5% of the region have been neglected for a very, very long time. So it's been a tall order to actually push for policies that support older people. When I started Rotom, the population census of Uganda did not even capture clearly the numbers of older people. It was 50 plus. That's where it stopped. So the first case was to advocate for recognition of the older people and their numbers. So, but we raised some money, and the best way we thought was to ally with the government, the Department of Law. So we started in 2006 and 2010, we were able to have a policy put in place. And that policy became the guiding of the establishment of the Department of Elderly in the Ministry of Gender and Social Development. That was the beginning of the efforts of our advocacy. Then we started creating awareness. They started staffing the department. And so it hasn't been easy, but what we've been lucky with is that when you appeal to Africans, because they generally respect older people, and you show them, whether they're politicians or younger people, that these are the folks that raised you, that are suffering, then you start getting sympathy. The answer that is challenging is to say we don't have the money. So we have worked with funding agencies like UK Aid and Danida and UNICEF to get the government, World Health Organization to use them to kind of put condition on other aid so the government can respond. So we have a social assistance grant for older people, which is in place because the donor world offered to help do a pilot on condition that if it works, the government would adopt it. So we have been creative, but the easier part has been mobilizing the older people themselves. We have established the Grandmothers Consortium, which is a national organization with groups of grandmothers across the country who can walk to their local office of the local leaders and demand their rights. The benefit for older people is they are a very good voting bloc. They are few, but when they promise, they deliver their promise. They are trusted. So they have openly and directly with our training, if we are not on the table, you don't have our vote. So actually in Uganda now, by law, every political structure has a representative of an older person, from the village to parliament. So we have 5 members of parliament who are only there to fight for rights of older people that can be able to engage economically. So it's been a lot of mobilization, awareness creation, but mostly mobilizing the older people themselves to demand for their rights.
You know, Kenneth, we have a lot to learn, you know, in the global north when it comes to mobilizing older people. So, you know, I can say, you know, with hand on heart that the representation that you have of older people, you know, in the government is certainly not in any government that I know of. I just would really like you to comment on the health centres, because I know that Rotem has been very successful in establishing, you know, good practice in health centres in geriatric care, because there would be very few geriatricians, you know, in Uganda and East Africa. So could you talk with us about that, and how did that come about?
Again, most of what I and Rotem have been doing is part of our own experiences. So when we started helping older people with healthcare, it was easy to raise money from friends in Canada to pay for healthcare. Little did I know the nurses in Uganda, the doctors in Uganda, people, they were not trained in geriatric nursing or geriatric care, and that they were overwhelmed by younger populations. So we have one granny or one older woman, man, to the hospital and not see a doctor because there are too many people. Secondly, in one very incident where I had a contract with our older people and I would pay at the end of the month, we were sent away. I remember the name of the older man that was sick. His name is Samuel. He had an issue of incontinence. The local health center was mission founded. It had one ward for male, not take care of his incontinence. They asked the whole ward smells. We cannot keep him and other patients here. So you find for him a room outside the health center. The nurse will go and administer his medication. And for a night and a day, they never showed up to administer the medication. And my caregiver called me and said, he's going to die here. Come and take him. I came and put him in my vehicle. It was an SUV, not an ambulance. There were not enough ambulances. And on build a health center specifically for old people. And even old people. In 2003, the older people came in and sat on the tile floor and ate food and just wanted to stay. who were not specifically trained in geriatric care, but just we loved old people and has become a model of care. But recently during COVID, we were challenged like any other. There was a national lockdown, there was no transport. So we had to of delivering care without getting everybody over. So we trained some of our nurses and could check blood pressure, blood sugar, and other things. And we could use a motorcycle to deliver the medicines. So we achieved 100% health access through the field nurse would make phone calls, use one vehicle to go to pick those who cannot be sent medicine by a motorcycle. And we have now integrated it as part of our healthcare for older people. And we think it's something people should learn. It's outreach-based, it's basic nursing, and that's what we do now. And it has helped us to cut costs, but also reach older people.
So Kenneth, you know, COVID is still with us. We're still in the midst of the pandemic. And while many countries are over the acute passage of COVID, I would be interested in knowing, you know, to what degree has coverage of vaccines, you know, occurred in Eastern Africa? But more importantly, are there any lessons that we should be learning from you as to how you have actually reached older people in this very acute phase?
So in Uganda, nationally, I think we are about 17% vaccine coverage. But among a small percent that has not been vaccinated, chose not to be vaccinated, and we respect their wish. We have actually done full vaccination and over 70% booster dose. Again, it's what we do. We are trusted by the older people. When we share information, they notice it is true and it's for their own good. And we have teams that go into villages. And because of our trust, the local departments of health made our health centers centers of vaccination and allowed us to do outreach. Luckily, right now, I think we've been wanting to be alert again, but the levels of COVID have been really very low. I think there are less than 100 cases in the country right now. I'm not even sure. They're quite low, but vaccination rates, we are very high in the Rotom supported areas.
Okay, look, thank you. We have some questions, and I would certainly call on a number of our cafe goers today, but I would like to ask on behalf of Shmuel, and Shmuel, thank you for being with us almost every week. Shmuel always comes forward with the first question, Kenneth. So his question is, what is the role of education in overturning or erasing ageist preconceptions in Eastern Africa? Is it, you know, what role can education play, Kenneth?
So we respect all the people. So if in our educational curriculum, there could be education about, you know, respect for seniors and the different ages and their value. And if they could be allowed, for example, to participate in education at local level, they could teach children how to like, through stories. I would give an example of the Rotom school. The Rotom has a school where many grandchildren come to, and we have sessions where older women and men will come and teach the children things they used to do, like trades, and also how to make meals, and also tell them stories. Now, these children love the older people and are endeared to them. So if we could include in our curriculum that is already overwhelmed, key education about just different ages, different needs, and how we are all important and deserve dignity, that will go a long way. But the other level of education we can do now, because we may not be able to go into schools, is just awareness through all kinds of fora, including religious fora, like churches and mosques, and because many Ugandans and East Africans will attend one of these places, and these places teach so many things. We know that religious fora were very important in overturning the spread of HIV and AIDS. So we could prepare some messages for the religious organizations and share them with them and ask them to once a year, just have a Sunday or a Friday where they teach about older people. This is another way of education or awareness that could be helpful.
Look, before I go to Mariam Kayinza, who's been making some comments, I just want to go back to you personally and your family. You left the United States when you had two little children, two boys, and now they are grown men with families themselves. And congratulations, yes. You're a grandfather for the first time in October. So congratulations. Yes. I want to actually talk to you about the generational movement of education, because I would suggest that your children would have a different kind of education and respect for older people living in Uganda that they may have in another country. Would you like to comment on that?
So it was, let me say, my children probably have, I don't know what they would say, but watching me abandon probably lucrative, higher level opportunity for this, my start grown and seen the impact it has had on other people. They probably have appreciated that there's more to life than physical and material success. So I'm sure that looking at me, and they have attended regular school and some of the better schools in Uganda, including universities. But I think watching me and my wife and the sacrifices they have made for this to happen, maybe the most powerful educational experience they may have ever had. I have had my older son mention at my 50th birthday that he really admires my kindness and generosity and sacrifice. But he also recognized that he had paid a high price because he could not bring his friends to our house because we had poor furniture, which, yeah.
Yeah, well, you know, poor furniture can be sorted out, lives can't be. So we've got to sort out what's most important at the time. But, you know, you also talked about the support of your wife, you know, in making this transition to Uganda.
So yeah, it was, they were quite young. They had been in Uganda also. So it wasn't very complicated. And we have my wife's very supportive. She was there all the time. She whenever I had to travel, look for support and sacrifice, she was available to support them through all this. And as a man of faith, I think God has paid me back. They have turned out as very successful young adult men. So we do not regret the price we paid, and we don't think it has impacted them very negatively, if any.
I think that what you've given back and what you've given out, you know, is many-fold of abundance. I'd like now to go to Mariam Kayinza for your comment, and then on to Cynthia Stewart. Mariam, can you hear me?
Yes, I can, Jen.
Okay, would you like to make your comment or question to Kenneth this morning?
Yes, Jen, I'm very delighted to hear from Kenneth. I wouldn't go without mentioning that I got a chance to interact with Kenneth when I got the inspiration to work with the aged. In my country, the government has done a great job to support the aged, but not maybe to our expectation. I would say an older person who is 80 is supposed to get a social support of $1, and they receive this 2 months after. And the process is, oh my God, very hectic for such a person, in all honesty. And when I found out that in my country there was an individual who with passion decided to make a difference and push for such policies, I was so delighted. And my passion and desire to continue working with the aged is because I found Kenneth, and I knew that we can make a great impact by supporting a section of our population which is always left out. So Kenneth, God continue to bless you in everything that you do. Thank you, Jen.
Thank you. We'll move on to Cynthia Stewart. And Ken Bluestone, I might just ask you to come in also and make a comment, because Age International does a lot of work in the Global South. So I'm going to call on you in a few minutes just to make a comment, okay? Just to give you the heads up. So Cynthia.
Yes, thank you, Kenneth. You are just doing marvelous, marvelous work in Uganda. Uganda is one of the African countries that has gone on record in support of a UN Convention on the Rights of Older Persons. And I'm just wondering if there's any way that you can be a voice outside of Uganda in the other 30 countries of Africa that have not yet gone on record to support a UN Convention on the Rights of Older Person. You know, we've got the 13th open-ended working group coming up in April, and it would just be marvelous if we could get a few other countries. And so I was just wondering, with your excellent skills and expertise, whether you had any thoughts or insights. Thank you.
Thank you. Cynthia, as I shared earlier, we are part of the across. So what we with the tools we receive from the HelpAge network, we are encouraging our politicians to convince their colleagues in the UN system to support, and especially because at the OAU level, many members have actually ratified the OAU protocol. So we wish they could go ahead and do the same at the UN level. But again, we use the tools we've had. The path we took in Uganda was to be allies of the government. The Ministry of Gender, Labor and Social Development is our allies. And through them, we can reach the Ministry of Foreign Affairs, which then goes and does the vote and the signing. So we'll probably work through HelpAge Network to see which other regional members we can share experiences of working with their department that then works with a department that goes to the UN system. And to encourage them to participate. Sometimes they don't know what's going on. Sometimes they don't have the finances to go and participate. There's so much awareness you create in the system on how it works. And the GAROP's support and HelpAge Network support has good tools we can use to reach out. So when I'm in these forums, I'll kind of look out and see how I can support.
So I think, Cynthia, you know, Kenneth is really saying what we're saying, that there are tools, we may have to adapt them to specific situations, but let's use the tools that are there. And I think, Kenneth, you know, to be a voice and to teach others, I think, you know, ROTEM is certainly key to that. So I just want to ask Ken Bluestone from Age International to make a comment, because Ken, you know, Age International do a lot of work in the Global South, directly and through HelpAge. So I'd just like to hear your voice and your perspectives about ROTEM and also advocacy in this region.
Thanks so much, Jane, excuse me. And Kenneth, it's wonderful to see you again. We're delighted that you've created this platform for Kenneth to share his experience. It's so important, and it's also very pleased to say that in our very small way we've helped to contribute and accompanied you on that journey. I remember you mentioned the pension scheme that has been introduced in Uganda, and I remember having a conversation with the UK government about the support that they were providing to that pilot scheme, and pleased that we were able to convince them to use their position and their advocacy to help advocate internally as well, because, as you know, it very much due to the activism of older people themselves in Uganda, but the Ministry of Finance required some, I think, convincing that this was the right step to take. So I think together we all were able to do something to achieve an amazing result. Kenneth, I do have a question though, and we've been involved in conversations together very recently about long-term care with the World Health Organization, and as we all know on this call, one of the things that WHO has identified as being one of the biggest obstacles to achieving better health is ageism. And we've heard so much about what is powerful in the valuing of older people in Uganda, but you must also be experiencing other attitudes and other ageist attitudes towards older people as well. And I just wonder, how do you go about trying to address those? What is most successful in Uganda for tackling ageism?
Again, as I shared, Ken, thank you again very much. Through HelpAge, some of those earlier convincing workshops were funded by HelpAge through us and Reach the Aged Association. There was a lot of work, so I'm glad you're on this conversation. It sounds very easy when I give the reports, but it was many years of a lot of lobbying and efforts, even to have the older person's policy, that, Ken. But we thank God it was not in vain. But one of the benefits was formalizing the place of older people through the Constitution. Having older people on the different levels of political leadership of the country has led to tremendous success, because wherever there is a meeting, whether it's in the village or the parish or the district, there's going to be some older person who knows they are not only older in age, they are principally there to represent all the people's interests. And that voice is regular and relevant every time there is a decision-making process. That has been the most successful that we could achieve. I remember earlier on when we took the older people to parliament to demand for members of parliament who are older people themselves, we were laughed at as a laughing stock, because some of the older people in parliament said, we are already there, but they are just there because they are there. They were not there for older people. Luckily, over time, we are listened. So that's the number one. The second one has been having district level advocates who themselves are older people. You know about the Grandmothers Consortium, Ken, which I chair and was very instrumental in founding. It has 10 national advocates who are grandmothers who all the time, all they do is go to offices and lobby and advocate and present, including meeting the president himself. But they also have in 10 districts, another 10 whose job is to lobby at the district level. We have trained them, so they're just all the time speaking in the ears of politicians and policymakers and government workers. They have no peace. They cannot let them free. I think these two are very effective, and some districts have adopted some very progressive rules around access to healthcare by older people, for disease medicines to be studying and formalizing some of these things in law, like we've done in representation, as well as regular advocacy through older people themselves. What we can do as their servants or agents is train them and facilitate them to be in the face of the policy and decision makers. That's what I can say. There are so many other things that we do, of course, but those have been the most impactful, I could say.
Look, thank you, Ken, and thank you, Kenneth. What we've just heard here is that we have an organization that is global in Age International, that is supporting in a direct and indirect way, through the government, Ken, in England, but also you can hear the bottom-up approach. And I liked your mannerisms, Ken, Kenneth, when you're doing this. They just talk and talk, the older women. And it's the voices. It really is the voices. So we've got 3 more questions, and I do want to get to all of them. Amara Francis, Razak Ghiazi, and then we'll go to Tom McCormack. So, Tom, you wanted to ask Kenneth a question.
Yes, thank you. And thank you, Kenneth. I'm told that the burden of dementia is rising in Africa. Might you comment on dementia care within your organization?
Thanks, Tom. Good to have you with us.
Thank you, Tom. Yes, the burden of dementia is increasing, and sadly, our healthcare system and social care system did not have a way to diagnose and treat dementia. Therefore, in many ways, it was looked at as something else, So, but luckily now, for example, for autumn, we have one of our medical workers doing masters in dementia studies. We have also hosted Makerere University Medical School students to do their master's study and develop a tool on how to make assessments for dementia so that you can accurately diagnose dementia. And we, with our staff who is doing his master's, when he completes, and with our collaboration with the students from Makerere University postgraduate program in medicine, would like to establish a center for dementia studies and dementia care. And the focus will be on just developing tools and adopting tools so that we can do proper diagnosis of dementia and also provide care. Luckily, already our existing program of care, which involves home visits, which involves social support groups, which we call fellowships that happen regularly, which involves treatment of other illnesses, seems to be ways of actually managing dementia. And we think we'll just get better at it and integrate in it. But we recognize it is increasing. We recognize there's very few special people who have this education and awareness. And now efforts have begun to be made from, again, as I said, Makerere University. A few students have done research, and Rotom in itself has sponsored one of our staff to do masters in dementia studies at Stirling University in the UK, with the aim of establishing a center for dementia care at Rotom itself.
Okay, thank you very much, Kenneth. And I'll go back now to Amara. Are you with us? So Kenneth, Amara is saying thank you. You're an inspiration. In addition to education, advocacy is needed to University Commission and education boards to include aging education. So she's asking for an expansion to pre-service education and other professional in-service training in the next action plan. So I would imagine that you would support that. It's really a continuous process.
Great advice.
Yeah.
Great advice.
Great advice. Okay, good. I will just make the comment from Razak. So Razak talked about your amazing work to support older adults in Uganda, and the African Population and Health Research Centre, APHRC, in Nairobi has been doing a lot of work in this area. And I know that Isabella Abodaran, was certainly central to that. And certainly Professor Jaco Hoffman would be as well. And Razak said that it's on their table to work with you, Kenneth, and unravel how synergistically we can support the health, well-being and quality of life of older adults in Africa. Would you like to make a comment on that?
Thank you very much. I just want to say thank you and appreciate that openness to work with us to improve care. We are learning over the last 20 years that our support, for example, has enabled older people live longer. We know through annual impact assessments that older people are living 6 years longer in the last 10 years because of our support. So we have many more requiring long-term care, and healthcare becomes really looking at this work that has already been done in Kenya and the rest of Africa, as well as we've reached out to Interright to see if we can work with them and knowledge on how to really improve care. So I'm just saying thank Raza and just tell Rotom is open and willing. So is other Ugandan community-based level organizations, and will be a channel too.
I certainly believe that IFA needs to do some more learning from you, Kenneth. So I think the learning comes from you to us and not necessarily back the other way. I did want to just ask a question about non-communicable diseases. We see an increased prevalence of NCDs such as heart disease, respiratory disease, diabetes, you know, and it's really, you know, of great concern, because that then makes our immune systems much weaker. You know, are there any avenues to really talk with older people and younger people about lifestyle changes, or is that not on your agenda?
With older people, yes, and specifically the older people we support, we actually do at Rotom an annual screening for non-communicable diseases. Our target for this year, for example, is 1,000, was achieved 1,000 screenings, individuals screened, and we are finding a big number having high blood pressure and high blood sugar, and we put them on a treatment plan to avoid other complications, including, you know, heart attacks and strokes and other things that then would disable them. I actually wish that some of my doctors, like Brian or Emma, were here to give an example, but we recognize that, we do it, but sadly we are not able to reach out to the younger populations through school, because it's better to start earlier than late.
Yes.
Even mid-age, leave alone the children, even people in their 30s and 40s, their lifestyle is not worried about it until it is too late.
Yes, yes. Look, thank you for that. My last
Actually,
question
we
goes,
do a lot of nutrition education and exercises,
yes,
and we see it is making a difference, but a little bit more has to be done, and I think the same way in the education system, probably.
yes, yes, you're right. So Indu Gambia, Indu, are you with us? Kenneth has taken you back to your childhood. Did you want to make a comment and pose your question?
Yes, he's taken me back in my childhood, where I was taught that elder people are at home are respected. So when you came home, you always greeted them. Whether my friends came with me, we all greeted. And that was part of not having and learning from them stories. And loneliness was not felt by my grandparents, which is why when I came to Canada, it was really surprising for me that you called older person with their first name.
Yes.
So I told my medical professor that I will never be able to call you by first name. And please don't take it as an insult or anything, because all my colleagues were calling him by first name. So I just feel that the education and respect from childhood, as Kenneth said, whether it's in school or it's in churches or anything, to respect elder people will be the key for the younger people to look for health of the elder person as a very important part. Because when we start teaching at medical schools and others, the base is not there. They still see elder people as a equal to them and call them by first name and anything. So Kenneth has taken me back of the values I learned as childhood. And I found these are same values in First Nations and Inuit. So I have always learned medicine from Inuit elders. Whenever I go to their community, I first meet with the elders and ask them how to communicate. What are the words you use for something? So I think we need to not only just take care of elders. So for Kenneth, I worked in Uganda with MSF, so I know how much changes you are making. And we just all need to learn from different models which are used over the world. So Kenneth, I'm glad. And if you ever come to Canada, I'd like to meet you and learn more from you. I don't have any question. I just had the comments.
Thank you, Indu. They're valuable comments. So Kenneth, did you like to respond?
I just appreciate that she sees these things the same way, but sadly, there is increasing influence that may change that tradition and culture of respect for older people. The way our young people are learning, the way we are learning is from other cultures and internet, and to be able to know what to keep and what to adopt is not easy. So there has to be a conscious effort to advocate with those who make curricula that some of these things may be important to keep to avoid future challenges of all the people who are neglected and suffering. Because when you do that, it becomes more costly to correct much later. So I had heard earlier from, I think, Raza, no, I don't remember, about advocating at the education level in terms of curriculum development. And
Yes.
I think it's an easier way to advocate because there's in Uganda National Curriculum Development Center, which you can target as a place to advocate.
Yes. I think that you and Ken Bluestone really talked about a very complicated advocacy. You know, we use this word advocacy, you know, in a very sort of passé way, and yet it's very complicated. It takes a long time, and it takes many times to actually achieve success in changing policy. One question from me before we pause for a minute, and that is, if you were sitting here in 2030, what breakthroughs would ROTEM have made in the next 9 years for people in Uganda and generally in East Africa?
So the biggest question that is at our forefront right now is finding appropriate long-term care in our context. If because the existing long-term stretched by, and the seniors are now home alone and they're getting very old. So if we could, in the next 9 years, have found out that fits in our environment, that'd be very, very good. Secondly, for East Africa, if all older people that are 60 years and older could have access to pension, universal pension, that would really make me very happy. And thirdly, care for older people. It's just, healthcare in East Africa is just so under pressure. And the ones who are left behind are those who cannot push themselves on the lines, waiting. So if they could be in the center of healthcare and receive equal healthcare like others, or even better, those three would really be a big achievement.
Okay. Look, thank you for that, Kenneth. I just want to pause there, and I'm going to introduce our next week's speaker, and this will be our last Global Cafe for the year. And then I'm going to come back to you, and I'm going to ask you for your closing comments. I have the great pleasure of introducing Greg Shaw next week, the IFA's Director of International and Corporate Relations. And I'm going to be talking about the 2022 retrospective. So please join, ask hard questions of Greg, and really get to the nub of what the reflections of 2022 enable us to do and be going forward into 2023 and beyond. So, Kenneth, I started this Global Cafe by asking you a question about Margaret and Elizabeth. And from the conversation with Margaret and Elizabeth, you are the founder and executive director of Reach One, Touch One Ministries. It's a mission-driven organization supporting over 1,000 vulnerable older people, 400 grandchildren in their care. And for the last 30 years, you've really been at the forefront of fighting poverty among vulnerable older people and children in Uganda and across East Africa. I think more than that is that you have dedicated your life and living to encourage others to protect and respect the lives of all people, and most particularly older people. And in doing so, you have an infectious way of inspiring others. I do hope that you've inspired many more people on this Global Cafe, and going forward to do so, so that they can support, you know, the work of ROTEM, but equally they can take some of the ingredients that makes ROTEM what it is today in this work going forward. So Kenneth, would you like to close the Global Cafe by giving us a couple of takeaway messages for us to take away with us?
First of all, thank you for having me. It's an honor and privilege. But secondly, also thanks to everybody who has participated. That already shows me that they are keen and interested in aging issues. I want to say that the misconception that older persons are loved and cared for through the extended family system in Africa is no longer holding true because of the pressures of economics, of the past wars, HIV and AIDS, and also because of rural-urban migration. Therefore, there are very, very many vulnerable older persons who are lacking dignity in all kinds of ways, especially women. And so I would just like to implore everybody to do everything we can because the older persons have worked so hard to build these societies. We who are all on this call, right, the fact that we can access internet and be here, have so much. And in my faith, we are asked that who much is given, much is expected. And it's more blessed to give, let me say, or to support than to receive. And I have received much more than I ever gave or even given up. Most of it being just a joy of seeing one or two older people being better than they would. Often we think the help is to give. Yes, you can give wherever you can, but also often we have power and authority and opportunity to influence decisions that would improve lives of so many people, as Ken shared about their influence on UK aid that has since helped change so much in Uganda. And thank you very, very much. I look forward to participate and ask the hard questions of others next week and weeks that follow.
Well, look, thank you very much for your time today. I know it's been a very long week for you, but we very much appreciate it. Thank you, Mr. Kenneth Mugayehwenkyi from Rotem. Be well, stay safe, stay healthy, and we'll see each other next week at 7 a.m. All the best. Bye-bye.